All right. So I would like to welcome everyone to Sarah's thesis defense. I'd like to thank the readers, Dr. Leckenby and Caitlin, for their help in this in reading and providing feedback for Sarah and the time and energy that takes. Beautifully, you have two people who have different backgrounds. So Katie has a background in music therapy as the bachelor's degree, and then special ed for everything else after that. And then we have the rest of us who are more purely music therapy trained. So it's nice to get that additional expertise, especially someone who's probably gone through the CBMT and then left the field. So, all right, I'm going to hand it over to you, Sarah.
Okay, let me share my screen. Oh, wait, let me just do. Okay, are we seeing it? Okay, fantastic. Okay, so for the one of you who does not know me, I'm Sara Miller. Thank you guys for coming to my thesis defense on clinicians' perceptions of the CBMT exam in partial completion of my master's degree. So first of all, thank you all. Thank you to Sue for this and for everything. A single PowerPoint slide does not wrap it up, but that'll come in due time. Thank you to our superstar readers. I know the turnaround time from when we sent you the thesis to where we are now has been very quick. So I really, really appreciate your willingness to work alongside the craziness of the scheduling. Classmates new and old, which is very convenient that Rebecca represents both of those categories. So thank you, Rebecca, for coming. And just obviously the study participants, because without study participants, there would be no study. Okay, so why this topic? I had a very unique exam experience. I took the exam for the first time post-graduation, pretty soon after graduating with my undergrad, and I did little to no studying, thinking that the soonness would be enough to get me through, which was not the case. So I scheduled it for my second time around, and when I showed up at the testing center, there was me and there was one other girl. She was taking a nursing exam, and there was nobody there. They didn't show up until about 30 minutes after our exam time was supposed to start. They showed up and they said, the proctor is not here today, you have to figure it out. So this nursing student and I got on the phone with the PSI help desk, who walked us through proctoring our own exam. We took our exams, we finished our exams, and it was at an H&R Block, and the H&R Block employee told us, I lost your results. I don't, like, your 2 hours didn't count for anything because I can't find your results. So we both start worrying. We called PSI again, who walked us through printing our own score reports, and we shockingly both failed our exams. So that was quite a tumultuous experience, to say the least. CBMT was incredibly accommodating when I reached out to them. They actually helped me to reschedule it for the third time, completely free of charge. So they were really very understanding about the whole experience, but who's to say if that's going to happen again or has happened again since then. So that kind of inspired me to be like, well, I wonder what other people's exam experience was like. So it grew from wanting to learn about the exam experience to wanting to learn about prepping, what everyone's prep was like for the exam, and also post-exam and the feelings that are associated with that. I had a very particular interest in hearing from those who did not pass the exam on their first attempt, and the first time pass rate as of 2023, so this might be different now, is 69%. So I figured it might not be too hard to get perspective from those who did not pass on their first try. So I found in my research that there's a lack of literature that focuses specifically on clinicians. So there's a fantastic study that looks at program directors' perceptions of the exam, but I didn't see anything from the perspective of those who had more recently taken the exam. And I found, I want to say, no research exploring those who have first-hand experience failing the exam on their first attempt. So I found that there was a pretty huge gap there. I did find, like I said, helpful research. The program director's perceptions of the CBMT exam really led the charge in a lot of my research. There's fantastic research on the challenges leading up to the exam and then exam outcomes, but this like the in-between spot was still missing. So I wanted to gain insight into ways that how can we benefit future exam candidates? So not only did I look at music therapy literature, but I thought it could benefit me to look at other disciplines as well. So I looked at education exams, nursing exams, speech, OT, child life, anything that was kind of similar to music therapy. I mean, it wasn't too challenging because almost every profession has some sort of entrance exam, but I found it really helpful to look at other programs and how they practice their exam. So not only did I look at certification exams, but also test anxiety was really a common theme and something that became quickly and very important to me. And then competency-based education was something else that came up a lot in the research. So in reviewing my literature, there very quickly became 5 lenses that I was looking through when reading these studies. The very first one was the curricular focus of music therapy programs. There's so much subjectivity when it comes to what is in the curriculum of each program that it can cause a lot of flaws in the system, which goes hand in hand with the assistance that we get from faculty and supervisors in preparing for the exam. Because program directors are just finding it really challenging to fit everything that they need to fit into their curriculum. There's just so many competencies from so many different places that it's only 4 years. Competency-based testing and education. The format of the CBMT exam is solely multiple choice, but that doesn't really test for competencies or skills, which is what we're being tested for the whole time we're in undergrad. So there's just kind of a disconnect between our training and the exam format, which can cause a lot of anxiety that goes along with taking the exam. Test anxiety is often cited as a top barrier towards success. So in addition to test anxiety that just naturally comes with taking a high stakes exam, clinicians discuss having negative experiences with testing centers, which I can very much attest to, and test administration, which again is why I wanted to explore other disciplines and see how they were doing it differently. And I found very quickly that education's exams, they have a panel of education experts who help to score their exams. And on the nursing exam, they have partial credit. So those are 2 very big things that I was like, oh, that's kind of interesting. I wonder why we don't have anything like that. So the purpose of the study, just to reiterate, was to explore and analyze music therapy clinicians' perceptions of the board certification exam, hoping to gain insight in ways that might benefit future exam candidates, but also could benefit programs as to how they can help prepare exam candidates. So these were the research questions that I kept in the back of my brain when conducting the study and when reading the research. What can we do to help exam candidates feel more prepared to take the exam? Specifically, what are effective and ineffective methods for preparing? How does the quality of music therapy programs relate to clinicians' perceptions of the board certification exam, just kind of hand in hand with what I was saying about the content and the curriculum? And are there any outlying factors that make it challenging for exam candidates to pass, and what can we as a field do about that? So let's discuss the research and then we'll get back to our questions in a little bit. I sent the survey out online. It was an anonymous online survey that used multiple choice questions, fill in the blank questions, and all the questions were related directly to the CBMT exam, test prep, test accessibility, and test anxiety. And the survey participants were acquired solely from social media groups that were approved by the IRB. So it was Music Therapists Unite, and there's an MTBC study group on Facebook. In order to be eligible to participate in the study, they must have attempted the CBMT exam at least 1 time and have completed the clinical and academic requirements for music therapy. Like I said once, and I'll say it again, it was really important to me to get the perspective of those who did both fail and pass the exam, because I wanted to be able to have a point of comparison. And in the end, we had 28 participants. The initial goal was to send it on social media pages and also to the CVMT mailing list. There was an error on my part. There was a question on my study about the domain areas, and my domain areas on the study had referenced the 2015 domain areas rather than the 2020 domain areas. So when I reached out to CVMT asking for the mailing list, I sent them a copy of my survey, and they said that they could not give me access to that list unless I updated my survey to reflect the 2020 domains. At that point, I already had some responses, so I had to decide either get rid of the responses that I already have and start fresh, but send it to the CVMT list, which is quite extensive. It's a large list, or keep the results that I have and just post it on social media. So that was the decision that we went with. It did lead to a small sample, but I wasn't willing to lose the perspective of those that I had already heard from. And also, I wouldn't get the perspective of those who failed the exam or haven't yet passed the exam if I only sent it to the CVMT mailing list. So that was what was most important to me anyway. Analyze the data under the lens of how can these results benefit future exam candidates, and the following themes were apparent in the results: exam accessibility, exam prep, levels of support at the academic and internship level when preparing, particularly challenging parts of the exam, and then the most important one in my opinion is the exam scores in relation to perceived self-concept. So just some demographics of the study and also of the CVMT and AMTA. My results kind of reflected the demographics of the AMTA in that majority female, majority of the respondents were white. Most of the respondents from my study come from the highest populated regions, which were the MAR, the GLR, and the SER. And the first time candidate pass rate of the CVMT is 69%, and for my survey it was 61%. So that was kind of nice to know that I was pretty on par with the general demographics. Of the 28 participants that we surveyed, 17 of them passed on their first attempt, 2 of them did not pass at the time of the exam, and 9 of them had 2 or more tries before passing the exam. When asked if there were any restrictions that hindered them from taking or retaking the exam, of the 17 that passed on their first try, only 5 of them admitted to feeling restricted, and of the 11 who didn't pass on the first try, 8 of them experienced restrictions. So minority in those who did pass on the first try, majority of those who did not pass on the first try. And some of those restrictions included related costs, long distance to and from the testing site, and restricted scheduling options at the testing site. When asked if they lived with any of the following that made taking the exam more challenging, the top response was 13 out of the 28 people admitted to having test anxiety, and other responses were depression, ADHD, OCD. One person said they have POTS, which means they need access to water, and then also autism, dyslexia, language processing disorder, and bipolar personality disorder. So lots of accessibility things there. And then asking if it was accessible to their individual test taking needs, 75% yes. And of the 25% who said it was not accessible to their test taking needs, they experienced physical discomfort, such as like distracting noises in the test area, temperature control issues and not being able to wear a sweatshirt, and then the discomfort from just limited and monitored water breaks. So for the question, what was the source of your exam prep? It was one of those check all that apply questions. So they were able to select as many as they needed, and 100% of respondents said independent study was a source of their exam prep. About half of those said that this was their only source of exam prep, And when asked what was unhelpful, what they found was unhelpful when preparing, they said reading old textbooks, studying for long periods of time, and cramming a lot of information into small amount of times. And most commonly, people said practice tests were unhelpful. They said that the self-administered exams that you can purchase from the CBMT are much simpler than the content of the official exam. So they didn't find those helpful at all. And then specifically, what support did you receive from supervisors that were helpful? Someone specifically said, since everyone who is meant to help students prepare for the exam has such different experiences, it was very challenging to get good support or advice. So I think it was less of not getting help from supervisors, just that the help they were getting wasn't really conducive to the preparation that they were doing. The most challenging area of the exam from the majority of respondents was treatment, implementation, and termination, which is the largest section on the exam. There's 70 questions, and the next highest populated section only has 40 questions. So I think this might provide perspective for future exam takers and those prepping for the exam, that maybe this is the section we should spend the most time helping prepare for. And then when asked if their most challenging area of the exam was also their lowest scoring area of the exam, it was hard to get a read on that because most either didn't remember or didn't have access to their score reports. So, did you work as a music therapist prior to passing the exam? Many did not seek work as a music therapist pre-certification. 10% of them were prevented from employment due to lack of certification, and about a little less than half worked as a music therapist prior to passing, with the stipulation that they needed to get their certification within a certain period of time. And 2 respondents reported that certification was not a requirement at their place of work, which is the case for me. So I worked as a music therapist before receiving my certification. My title was music therapist, which led to a lot of internal feelings that goes hand in hand with our next slide. So self-concept, as I mentioned in the beginning, was I really wanted to focus on this specifically, because you can research all the live long day perceptions and scores and everything like that, but I just feel like it's really important to say, how is this affecting us? So we asked the 11 respondents who didn't pass the exam on their first attempt how not passing affected their self-concept, and it was a fill-in-the-blank question, and I took every answer, and every time the word was said, I threw it into this word cloud. So you can see that the biggest responses were failure, dreadful, sad, low self-esteem. People said they were discouraged, defeated, they felt incompetent. More than one person claimed to have feelings that they weren't enough, or they weren't meant to be a music therapist. Failure on the test led people to doubt their skills, and one person even reflected on being treated unequal by colleagues who had already passed the exam. The next couple of questions was giving a few statements and asking them how they felt about that, whether they agreed or disagreed. The first question, my exam scores reflect my competence as a music therapist. Pretty strong favor for disagreeing with that statement. My undergraduate program's approach and philosophy was well-rounded enough to fully prepare me for all topics on the exam. Pretty strong agree on that question. And then the last question was just about the format of the exam and with it being multiple choice, and that question was a little across the board, mixed reviews on that one. So back to our first research question. What can we do to help exam candidates feel more prepared to take the exam, and what are effective and ineffective methods for preparing for the exam? I think the number one thing would just be to designate some more time at the undergraduate level to discussing exam content and also the format of the exam, with a focus on the sections that the majority feel are the most challenging. And I think it was pretty well proven that the most ineffective method, was the self-administered exam. So I think either we work to make that more comparable to the actual exam, or just don't focus on those questions at all. Second question, how does the quality of music therapy programs relate to clinicians' perceptions of the board certification exam? There's so much subjectivity when it comes to what is provided in the many different programs. research suggests that each individual program is tasked with making decisions about which competencies, if any, receive emphasis in their academic programs. So there's a lot of discrepancy among the programs, which leads to less uniformity with how we're being prepared for the exam and also how we're being prepared to work as professionals in the field. So I think that if we tried to make it more of a uniform process with all the competencies and different assurance boards, that might have a positive impact. Are outlying factors making it more challenging for exam candidates to pass, and what can we as a field do about this? So test anxiety, test environment, temperature in the room. So I feel like these are a lot of things that can be controlled, like the test environment, the temperature in the room, being able to bring water in. How can we work with CBMT and testing centers to fix simple issues like that? Because then that could in turn alleviate some of the test anxiety that comes as a result. So I think just working alongside not only the CBMT, but also the testing centers, that's like the root of the problem there, to alleviate some of the anxiety that is associated with taking the test. Okay, so a few takeaways. There's a lot of discrepancy among programs, as I've said before, and I think that it leads to less uniformity with how the clinicians are prepared for both the exam and us as professionals. So we have to decide what the content is, decide how it's being taught, decide how to prepare for the exam, actually prepping for the exam, taking the exam. There's so many steps that lead to actually taking the exam, and there's just a really big disconnect in these transitions. So I think the amount of content is the main issue, but also AMTA and CBMT not being in agreement about what the content is also a major flaw. The challenge of fitting everything necessary into curriculum, again, there's just so much content, and that's why students are turning to internship supervisors for help when preparing for the exam, which in theory is fantastic, but that's just another perspective that they're gaining. So that could just cause more issues for them. They pointed out that each individual program is tasked with, again, making decisions about which competencies, if any, receive emphasis, which I just think is so interesting. They can just decide not to choose a competency, and then that could be a huge focus on the exam, and then we as students are very confused. Multiple choice alone cannot test for competencies or skills, but only knowledge based on theories favored by the test makers. So multiple choice, yes, is the easiest and fastest way to score an exam, but it's really restrictive because it's really not the best demonstration of what clinicians are able to do. Throughout all of our schooling leading up to the exam, doing observation and fieldwork and internship and role plays in classes, you go from that to the rigidity of a multiple choice exam. There's, again, just a really big disconnect there. So if there's a way to maybe incorporate the CBMT exam format throughout our training, maybe it'll help students to feel better prepared. I really liked this quote. Some of the strongest students in the field had the most struggles with the multiple choice nature of the CBMT exam, whereas many of those who were less clinically competent but competent in taking tests seem to have less trouble passing, which seemed to be a clear reflection of their test-taking competence. So it's really not proving anything other than that. You can memorize a lot of facts. And the fourth thing, test anxiety is the most common non-academic factor examined in high-stakes testing. 13 out of 28 of the respondents admitted to having test anxiety. So it's not about avoiding those feelings. I think it's about learning how to anticipate and cope with those feelings. And like I said, what can we do to minimize the risks? So whether that be working with test centers or preparing us differently, it could help maybe alleviate some of the anxiety that's associated with just being in a high stakes testing environment. One of the biggest limitations was definitely the small sample. 28 is a number, but it's not the number I was hoping for. It definitely would have been a broader study if we could have reached out to the CBMT mailing list. So I think that's a very good implication for future research. Had I not had the question about the outdated board certification domains. I think it could be beneficial to replicate the study, like I said, and send it out to CBMT membership. Other limitations were in the wording of the study, as I have never conducted a survey before. And just future research, I think we could look at more accessibility during prep and taking the exam, and then how to better our self-concept as a result of the exam, whether you pass or whether you fail. I feel like it's like you pass the exam, now go be a professional. I feel like there needs to be a little bit more of a connection there. So there are many factors that affect an individual's test-taking experience, both personal and environmental. I think there's definitely room to expand on the results. If connecting with a broader range of people, there's space to explore why the CBMT exam left participants with such negative self-concept and what that means for us as professionals. And I think there's also an opportunity to expand on what programs can be doing differently or better. I think that's it. Should I stop sharing my screen now?
Yeah,
Okay.
you
Wait,
did it. You did it in less than 30
I
minutes.
know, I knew that was gonna happen. I talk so fast. Wait, did I stop? I don't know. Oh, stop share. I see it.
So great. Thank you very much for your presentation. And
Thank
now
you.
comes the other part, which is you answering questions and listening to comments. So it's is there an order in which the readers would like to go in terms of asking questions? Why don't we start with Caitlin, and this is your first experience in that?
Yeah. So first, thank you, Sarah, for doing this research and for sharing your experience, which I'm just horrified that that was your experience. It's so deeply upsetting. Um, so thank you for being honest about that and sharing that up front. Um, and I'm wondering, with you sharing that so openly, if or how you think your experience might have shaped the way that you did your analysis, right? Like thinking of like your closeness, your position to this topic, right? Um, if you were maybe identifying with some of the feedback you were getting, right? Just wondering if you could talk about that a little bit.
Yeah, I think definitely I had identified with it, maybe to a point where I had a little bit of a bias there because I had such a negative experience that I was like, I also want to hear others who had a negative experience. So I
Mhm.
think maybe I was a little skewed in my view because I had such a negative experience and because it led to such negative feelings for me. I think that I was maybe on a personal level looking for people who that resonated with and maybe even just to validate my feelings. So I think that maybe that led to a little bit of bias, but yeah, it definitely drove the inspiration for a lot of the research.
Yeah. And of course, right? Like we're going to have
Yeah.
like that comes with the territory, right? And it's being aware of it like you're talking about, right?
Yeah.
Um and I'll just share, Sarah, and just for all of us, right? Because this is like a discussion. I think this opens up a lot of people wanting to share their experience, right? And I'm one of those people that did pass their first time, but by like 2 or 3 points. And I remember seeing that number, and even that made me feel like, oh God, like I just by the skin of my teeth got through. So even if you pass on your first time, there can still be those feelings of, but I just barely became a music therapist. What does that mean about me and my skills? And right. So I want to throw in that perspective too, that I think that even people who pass the exam might still not feel so great after passing.
And I think
Yeah.
that my question with the self-concept, I asked that question to the 11 people who failed on their first attempt, but it could be really interesting to open that question up to everybody. Just
Yeah.
how your self-concept been affected by taking the CBMT exam.
Right. Like somehow I passed, but I didn't feel good taking the exam or I
Right.
didn't feel confident
Hmm.
with my answers, right? So yeah, I think that would be really interesting.
Yeah.
I would love to just say something here so that when you listen back, Sarah, you know what to
Mhm.
do. Is I think this idea of being reflexive about the ways in which your experience impacted how you looked at it should probably be included somewhere. But also in terms of future research, maybe it would be worth saying that a research study would be really interesting in having people reflect on how their scores on the CBMT impacted their self-concept, whether or not they passed first time. So those are two things that you could definitely add. So I just
Thank you.
wanted to say it so you don't forget.
Thank you. I appreciate it.
Katie, do you want to, we can come back to you again, Caitlin, but Katie, did you want to say something?
Sure. I actually wrote, so me too, I'm like old school and I like to like write it. So I actually wrote it in the limitation section that maybe you might want to consider adding that personal, I just that it might be a possible bias to your limitations from that personal experience. And that's nothing bad, it's just
Yeah.
is what it is, yeah. But I thought it was really interesting, especially because everyone takes it, right? Everybody has to take this exam. And I remember myself long time ago, taking, I'm not gonna say when, but I remember like on the back porch at my parents' house, and I had like printed out a practice exam, and that was pretty much all I had to go off of. And I was just like, all right, we're just gonna hope for the best here. So I thought it was really interesting because, like you had said, not much is done from the perspective of the person taking the exam. What are your thoughts on adding your survey possibly to the appendix, or because I would have liked to see your survey and see what the questions look like.
I met with Sue earlier this week and I realized that I needed to add that. There was something else I have like a list of things that I need to add, but that you read my mind because that is on my list of things to do. I want to add a copy of the survey to the end of the study. I also wanted to ask you guys your opinion on adding the actual word cloud to the paper. Do we think that's like redundant, or?
I actually had here, yeah, on page 24, I had put that it would be helpful to go further into that. And that was where you talked about the study participants using words like failure, dreadful, discouraged, because my first thought was, well, how many times did the word failure come up, or how many times did the word? And so I had put in my comments, like maybe add a table with the participants' responses, or some way to show how much repetition there was among those responses.
Okay, yeah, that's helpful. Thank you.
And just before we go on, I wanted to add something that struck me as you were presenting. At one point, you said something about quantitative and qualitative research methods, and you need to change that. You had quantitative and qualitative data collection. Okay, so or that you collected both quantitative and qualitative data rather than research methods. So
I think it's like it says it on my slide, but I consciously didn't say it out loud because maybe not the right thing. Okay, I'll fix that.
So that's something just to fix.
Okay, thank you.
Okay, did you have something else that you wanted to add, Caitlin? And then we'll
yeah, and I'll just share that to all of us, that email chain that we have going, that I had like made some comments within the document, so I'll just send that to you all so that you can, review and take a look at that too. But a quick question, and then maybe I could ask a little bit of a longer question. Your survey was only for people who completed an undergraduate degree, is that correct? Or for grad as
I
well?
actually don't know if that was specified in my IRB application because I posted it on social media sites, so really technically it wasn't limited to one or the other. So I don't think
Okay.
that was specified.
Okay. Yeah, because there were times where it was saying like your paper, You were saying that you were interested in the undergraduate experience, and then other times it would say, anyone taking the MTBC exam or CBMT exam. So I was just curious if that was part of your like your criteria for your participants, if they had
Yeah,
an undergraduate degree.
maybe correct me if I'm wrong, but I don't think we specified one way or the other. So maybe just in the wording, I can make that a little more
Clear. Perfect. Yeah. And then curious, as Sue mentioned, your method, why this method? Why did you decide to do a survey instead of interviewing people? Because even like as we're all sitting here, it's like we all want to like talk probably about our experience, right? So I could imagine that there would be a lot of
yeah.
really rich data that way as well.
Mhm.
And you gathered a lot of rich data too. So I'm not challenging this. I'm just curious why you wanted to go in this direction.
I think honestly, it didn't really even cross my mind to do like an interview kind of situation until I was analyzing the results and I realized how much I gained from the questions that were like the fill in the blank or the answer your own kind of situation. I
Mhm.
think that I maybe again with the bias of me seeking like that validation that other people felt the same way I did, I wanted like the concrete numbers that like, yes, I felt this way or yes, I felt that way. So I think maybe subconsciously that's why I did it that way, but I do agree that it could be interesting to maybe expand further because people clearly have a lot of thoughts and feelings about the CBMT exam. So I think that is another possibility to expand on the research.
Yeah.
Also, because we until recently we haven't done surveys through our program, but we've
Mm.
just had a spate of them. But I think Sarah also was really interested in getting a large number. Unfortunately, it
Yeah.
messed up.
Mm-hmm.
But had that limitation not happened, we may
Right.
have had 500. I mean, in some of our other surveys, we've had over 500 respondents, and then
Mhm.
that would bring a very different kind of set of
Mhm.
data. But
Yeah, and I think especially because with some of the surveys that you get sent through the CBMT mailing list, it's very like niche and specific. But had I sent this to the CBMT mailing list, it's every single person who receives that is eligible to participate in the study. So I really do think that I'm questioning myself and if I made the right decision to forego the CBMT mailing list or if I should have just changed the survey. But that's neither here nor there because it's done by now. So, but future research.
Mhm. And most times when you do one research project, then that informs your next, right? And like you can build and build off of it. So you could even think of this more as like a pilot study, and then everything that you gain from this experience, if you want to, be a researcher. This is an important topic. So I'd be so eager, to learn more about this
and then if
yeah.
you did do something like that, which I'm thinking that you're probably not, but if you do something like that, you could do it to the whole mailing list,
Mm.
and instead of having them write in answers, if you would be willing to share your experiences, especially around these areas, please give a contact number, and then you could have a mixed methods because you've got your survey, and then you've got a small number of people that you do a more qualitative methodology with,
Mhm.
that and then you would have mixed methods.
Right.
Maybe someone else will do it.
Be my guest. You have my blessing. I'll come watch the presentation.
It was like, I just want to get through here.
I'm sorry, I
It's
spoke
so
really,
ready
really
to
fast.
graduate.
I know I speak really fast when I'm nervous, so I hope I was trying to pace myself.
Katie, did you have something else?
Not really. I mean, I have, a lot of comments. Did you happen to add an abstract?
That's on the list too. That's the
Okay.
other thing. Yes, that's on the list.
And then I think one of my other things that I had probably made a couple references to, was to maybe go a little more in depth, giving some more examples, because there were a couple times where it said like a lot of other professions require some type of certification exam, or a lot of other areas. So I had said maybe just give a couple, specifics, like counselors take the, licensing exam, and
Okay.
but I'll scan this all and
Thank you.
send it. Yep, sure.
She really is old school, and I love it because you will get it all hand.
That's how I was taught. Right?
Right, from way back then. I'm so glad you didn't say when, because then I would have had to have admitted that I was your undergraduate professor. But I was just a baby at that point.
You were.
With very little gray hair.
Mhm. With
Yeah.
none. Yeah.
No one actually these days knows that I actually had dark hair. When I say that, they go, "What?"
Oh my gosh, it was like black, right? It was, yeah.
Katie and I go way back. Caitlin, any more comments, questions? I know you had a more in-depth question, I think.
Yeah, I had a question about, thinking back to, or part of positionality, right? Which I'll just say from my perspective, I think like is the most important aspect of research, is just like where you're coming from. But along with that, I'm wondering, as you collected all of this important data, um, you know, how did you check the information that you were getting? Like, did you have a process where you worked with Sue, or like, was there any triangulation, or, like I'm thinking to myself, and of course, Sarah, I trust you implicitly already. But as a reader who doesn't know you, um, what could you share with us, or within your written thesis, that would allow us to really trust you in the way that you gathered all of the data and the way that you analyzed it? Like, what process did you go through with that?
I mean, the turnaround time between when I received my results to where we are now was very quick, and that doesn't help my case. But I mean, there were definitely sessions where I sat down with Sue and we did analyze the results together. So I was held accountable by another researcher, because I guess I'm the co-researcher. So I think maybe mentioning that in the research could be helpful, but other than that, there wasn't like a huge process to it. So I'm not really sure what I would say to, like, because it's a good point. Like, why should they trust me, you know? So maybe finding a way to make them trust me. Finding a way to say that. No, but you know what I mean, to say like there was method to it.
And the fact that some of the ways that you gather the data was quantitative is like, again, I think seeing the survey questions would be super helpful. And I don't think I realized until your presentation that some of your questions were like in a Likert scale. Like, I didn't know that by reading your paper. So I was kept being so curious about like how are we answering this question? Is this one fill in the blank, or was this one multiple choice, or how, and also thinking about, the possible parallel between like test anxiety and then like, what answer do I pick for the survey, right? Like, I'm just curious if there could be overlap there too. Yeah.
Yeah, and I think you can add more specifics when you're talking about different areas of what kind of question it was. I I want to just add to Sarah's response. For me also, positionality is incredibly important, and trustworthiness, especially in qualitative research. Even the way in which Sarah looked at the write-ins wasn't, in my opinion, interpretive. It was more post-positivist, in that it was like more, how many times did this come up, rather than what does this mean? And so in that way, I didn't spend as much time as I would in terms of ways of triangulating. It was more in terms of, okay, let's just make sure that these things are being done, as accurately as possible. So I'm with you on that completely, but I really don't see this as, that's why I said it's not really quantitative and qualitative methods, but data that was collected was both quantitative and qualitative in terms of write-ins. But in terms of analysis, I would say it was positivist.
Yeah.
Or at least
So
positivist.
Yeah. So maybe Sarah even mentioning that, in your methodology and your data gathering. And again, going back to that idea of you adding in the word cloud and what Katie had mentioned about maybe you have like a little table or something that says failure, it was mentioned this many times, right? Like that brings forth trustworthiness, right?
At least by this many participants, because one participant may have mentioned it many times,
right?
But at least you could say how many of the 28 mentioned failure, how many of them mentioned, and that's a kind of content analysis that is much more objectivist rather than interpretive. And you didn't put your ontological and epistemological framework in there, so but that's okay. Caitlin's like, no, it's not okay. It's not what we always say, but we can add that.
It's so funny. I haven't been part of your graduate work, Sarah, but I can already tell it's like you're just done. You're ready. You're just ready. You're like, yeah, okay.
Yeah. Well, for more context, I had planned on doing a different thesis entirely. I had a different topic. I was gonna focus on special needs patients in the hospital. I had an IRB board here at the hospital I work at. It was very complicated, and then one of the patients that I had planned on focusing on for my study had died, and my brain just wasn't in it anymore. So total 180 shift to this. So yeah, I am done. I am done. It's been a process.
At this point, Sarah wasn't doing any music therapy practice.
Yeah, when you said this, you were like, this could be the pilot.
And I was like, okay, we got to focus. We got to get out of here.
Right.
So this was like a whole change.
Wow. Oh. Okay. Well, that context certainly makes even more sense of
Good for you.
Thank you.
Got it done.
Did it.
We did it.
Yep.
Thank you all so much. Guys, I was so nervous and you all made this very pleasant. So thank you.
Oh, great job, Sarah. Truly.
Thank you.
Yep, it is done.
No more questions. You're all cut off. That's it.
And Katie, while we're all here, Katie, meet Rebecca. Rebecca, meet Katie.
Yeah, see you. I have it.
We're going to be all together on Friday.
Yes.
It's on my list to read.
Okay.
I'm gonna get it done. I'll get done.
Sorry that we're doing all these last minute ones, but
I know, and it's right before the school year starts too, so you're probably.
Oh, it started today.
Oh, okay, even more.
Oh, okay.
Which was why I forgot that I was starting a class, taking a class today. And that's why I was like, yeah, that time's fine. And then I was like, oh, no, I have.
Oh, are you taking it as a student?
Yeah, I'm taking a class at Westchester to get a graduate. They have a graduate program. It's a certificate in applied mindfulness.
Oh, okay.
Yeah, so.
Where did you say it is? Westchester. Oh, okay.
Yeah. I hope you didn't miss that for this.
No, that's tonight.
Okay, good.
Yeah.
Yep. Yeah, I get a lot of our students taking things at Lockhaven because they have more counseling classes online than Sabirot does.
Yeah.
I haven't even tried Westchester. I don't know if they do.
Yeah, this program's online, but it's only one guy that teaches the whole program. So
well, hopefully he's good.
Yeah.
I like the first class.
It's only 4 classes, so I can get through it. but I would love to start one at Sudbury Rock.
So you're getting all the ideas so that you can.
Yes, essentially, yes. Yes.
Fair enough.
Yeah.
So, okay. Well, congratulations on finishing, Sarah.
Thank you. Almost. There's a lot to do, but I did the hard part.
From here, both of your readers are going to send you some revisions. They will send me their rubric. Just because of our time frame with academic records, I will submit your grade based on feedback, and then you will have time to make it better by doing the revisions. And once it's better, we will sign the signature sheet, and then you can submit it to the library. But just because of the way things are going, needing to get, because you're a summer graduation, they're not going to give me any extension.
Okay.
So, which is why we're in this.
Crunch time.
I have 3 others after the Rebecca's, and they're all just being pushed through, which is not normal.
But they're getting done, so that's good.
Yes.
Good for you, too.
Yes, I'm trying to get between 21 and 29 completed by December.
Wow.
Then I'll be back to a normal load. Caitlin, what happened is that I used to let people have incompletes until they finished their thesis, and that has been horrendous. And so we've changed it through the curriculum committee that they have to re-register for it every 12 months, which is a financial drain, which is an incentive.
That's correct. I bet that works.
It scared a lot of people.
It's
Why this number is so high now.
they're like, oh, what, I have to pay? And I'm like,
Right, might as well finish this up.
So it's just been like one of these. I've had some people who have like drawn out.
Right.
Since
Years
before
and years.
COVID.
Ooh, yeah.
So this is just not happening. So, and I'm going on sabbatical in the spring. So I said, anyone who doesn't get it in by December,
Yep.
out of luck.
Yep. That's right.
And then we'll be paying for it. So yes, it is going to be hard on me, and I'm trying not to get the same readers all the time. But yeah.
Yeah. Ooh.
But I don't get a break from that. So there are different readers, except for I'm the same.
Yeah. Oh my goodness.
I'm hoping not too many things slip through the cracks. And so I'm really grateful for the things that you both have noticed. And that's going to help Sarah as well. So.
Of course. Yeah. Oh, well, and then good luck, Rebecca.
Yes, good luck, Rebecca.
Thank you.
Yay.
Almost there also.
I was just saying to Rebecca earlier when we were meeting that I'm trying to get all my Malloy people out ASAP. So I haven't, these are the first 2 that will actually graduate. And then I have Francesca, and then I have Constantina, and I have, who else? And
Stephanie and
Bethany. Yeah. So it's like,
yeah. Come on.
Kick in the butt.
yeah.
Oh.
So
Well, you're welcome, honestly. I'm done.
yes. You didn't think you were going to be the first one done, but the first one.
Honestly, you could have given me $1 million and I still wouldn't have believed you that I would have been the first one done.
yeah. You did it though.
Rebecca's like, yeah.
Wonderful.
She was so far behind me at one point. I was like, Sarah, let's go. We gotta go.
Rebecca was ahead of me the whole time, and I was like, I can't let her finish before me. I gotta go.
Competitive.
Yeah, it was helpful though.
Maybe you can contact some of the others and say,
I'm done. I just told you I'm done. That's it. They're on their own. No, I'll start a Malloy group chat. I'll be like, guess what I did?
Uh-huh.
All right.
Well, thank you everyone so much. I really appreciate it.
Thank you, Sarah, for doing this project, truly.
Congratulations.
Thank you.
Yes.
Take care, everyone.
All right, thanks everybody.
Bye.
Bye.
Bye.